All right, right. Thanks, Pakistan Brilliant, for hosting this event and giving me the opportunity to present. So, let me introduce myself. My name is Yasir Bashir, based out of Chicago. I'm working as a senior manager at PwC and doing Salesforce implementations for over 10 years now. Um, over It's been over like 7 years I'm doing Salesforce Cloud implementation and passionate about healthcare digitization and transformation. So that's what it shows today's topic of, sharing my lessons with this audience on Salesforce Health Cloud and how Salesforce Health Cloud is transforming the healthcare industry. So today we're going to cover Health Cloud vision and what this ecosystem is about, and then we'll talk about why Health Cloud is an obvious choice in the Health Cloud feature. I'll cover every in 25, and then towards the end, we're going to take question and answers. All right. As we all have seen how Salesforce has evolved over the course of 15, 20 years, and when I started working on the Salesforce implementation, it was 11 years of when it was just sales and service, and even for marketing cloud and experience, we used to have you know third-party applications like Pardot, right? And for community experience, we used to have those. And back in those days, for any like health-related implementation, we used to use Service Cloud. Down the road, Salesforce saw that need and they introduced uh, Health Cloud specific to the healthcare industry needs. And in this modern era, where digitization is being implemented, now everything is digitized and for the patient wider experience. Now we have medical devices connected with Salesforce Health Cloud. And of course, there are a lot of compliance needs. And for that, Salesforce Health Cloud has those enabled features available. Now, I think before we go further, I wanted to quickly touch on the different industry segments available in Salesforce Health Cloud. So Salesforce has introduced like specific features for the industry segment. Let's talk about provider first. So provider is very patient centric. So I know like, since I'm from Pakistan, that I understand there is no such system for patients available. But if we talk about US and other countries where everything is digitized and the hospitals, the doctors, they think that how they can build a patient-centric experience. And what they have seen is that if they don't give that experience to the patients, then they're going to switch over because now everybody has information available on their palm. They want to see what their reports are, how they're on their health, when is their next appointment due, and they have everything available on their mobile phones or tablets, etc. So there's a specific segment of health cloud dedicated to provider with most functionalities available. Same is the case with so for insurance companies, they have a different model and they have a different industry touch on, and they look upon how they can engage members and providers so that they can build trust and come up with a streamlined business process. 36% of members would switch if they don't have a better experience with their peers, insurance companies. Similar kind of experience is required for the pharma companies. They want to get closer to patients to deliver innovations. Whenever a drug comes out from the industry, goes through a different set of processes, and those processes are mapped to Salesforce through Salesforce's Health Cloud. And now companies are trying to automate this entire process where different scientists they're going to work and they're going to enter their results in Salesforce's Health Cloud and how they're going to share their research to Salesforce's knowledge architecture. Similar kind of use case available in the tech, where commercial companies that have products they want to use Salesforce Cloud. So the entire experience is available in Salesforce. All the sales and service inside, they want that to be in Salesforce. Moving on, to touch on how Salesforce's Health Cloud is tightly integrated with Salesforce's different set of features. So if you think about like providers here and pharmaceutical, there are tons of features available within the model. You have cloud service cloud, everything is tightly integrated with the health cloud experience. You can run your you can share data with patients, with providers, with doctors through experience. And then you Salesforce with external application, and it has to be done within the compliant and regulatory requirements. And for that, you have those compliance requirements available, and Salesforce Health Cloud has all those certifications available out of the. Now, the next question is why health? I mean, if you have in Salesforce Service Cloud, Health Cloud, the reason you will always opt in for Health Cloud because it has been tailored for healthcare needs. It has all the compliance requirements available, pretty patient-centric. So you will get out of the box through Salesforce Health Cloud, and there are specialized templates available, coordination is available, and you will have a by default take view for your patients. Moving on, we are going to touch on some key health cloud features, and we will understand as a group that what kind of features are available out of the box versus health cloud. Just want you to learn about health cloud and understand what features are available. There's a survey that is being done. Salesforce's cloud give additional 35% higher customer satisfaction if you are using Salesforce Health Cloud versus other industry CRM applications. So I think one of the features that we have is monitoring management. So what it does is in today's time, we have variables on us. So how's like your blood glucose, blood pressure, heart rate, everything is now integrated with Salesforce's Health Cloud. So if you want to share that information with your doctor, they can see that information live in Salesforce's Health Cloud, so that they can proactively engage with you. They can see, what kind of issues you're having with your health, and they will see that information on their dashboard, and they can give you right recommendations then and there. And providers also started to invest in remote patient monitoring. Since pandemic, the world has changed, and we understand that how all these things can take place from home. And for that given reason, now providers are investing in this. Hospitals, doctors, they are seeing information then and there in cloud, and they can quickly engage with you, they can make video calls, they can provide you real time updates about your health, and they can make decisions accordingly. Health Cloud Care Plans and Care Gaps. Salesforce Health Cloud provides you personalized care at scale with multiple care plans and care plan templates. We understand the industry and every provider, hospital, pharma company has care plans available. So you can easily customize them, you can configure them out of the box. You don't have to create a regular component for that. You don't have to customize it. It's all available out of the box. Just that you just need to move around the you have to like set it up as your customer needs. Um, you can manage all of that. You can also integrate the care gaps, care plan, with external application so that you can perform analytics. Since this is an AI time, and so has provided some features that you can easily integrate this Einstein analytics, and it could provide you generative-based AI insights on the patient and these care plans and care gaps. Moving on, intelligent documentation. This is one of the feature that is being widely used because you know patients are sending out their documentation to the providers. It could be a lab report, and so there are different ways we can take this information. Now, how we can improve the accuracy of this? So I think the key setup is out of the box. Like, whenever you see a document in Salesforce, if you get assigned to a queue from there, the executive will click it, you're going to perform the actions. But with intelligent form reader and context track, this information will map on your document into Salesforce. It's like a peer-to-peer mapping. It will extract from the document and it will map it to the record. It will see that information, it will assign it to the appropriate rep so they can perform inspections. It's like an OCR working on in Salesforce. All right. The next feature I want to touch on is related to medtech. So just like you're doing sales cloud implementation, there's a whole cycle for lead generation that how sales reps have to interact with different accounts. In medtech, the sales visits are happening where the sales reps are selling the devices. So they have to have that information available on their mobile devices, on their iPads, so that they can interact the reps on site, and they can also reach the serial numbers. So we haven't had this functionality before. We used to customize it, but now you can the product serial numbers on site for order authorization using your mobile barcode scanning to ensure more efficient inventory tracking. Also, you can product level and there is any project, any like projected shortfalls in your inventory. You can see that. Then of course you can manage your visits from your app. You can, schedule things from your phone, and you can see all that information in your dashboard. That if there is any inventory shortfall, your upcoming visits, etc. So it's pretty easy to like set those up in Salesforce Health Cloud. So there's another feature that is being widely used when implementing Sales Cloud. Salesforce's Health Cloud Tech. All right. I know we went too fast. We covered the features, and there is a lot more to our with Salesforce Health Cloud. There's a lot of features that we used to customize in the past, but now available out of the box. And Salesforce made sure that it's more drag and drop, point and click, and less customization. So whenever like you have a customer that comes to you on the health cloud, you need to understand the industry, understand the business processes, identify which industry segment they are aligned with. Are they a payer, pharma, tech, or a provider? And then think through and look through Salesforce guidance that are, features available for them. Look through them. Salesforce has more demos available that you can demonstrate and so that you can ask them questions. Also, like, Salesforce has introduced a cloud accreditation. So you can opt in for that. It's no like direct certification available for that. It's an acquisition that you can go for. I think Salesforce Health Cloud has a good roadmap to introduce more feature. And if you talk about US, every provider, pharma company, providers, now they are transitioning into implementing Salesforce's. So now I'll open the forum for any questions and thank you.